as I have been saying, meron tayong panibagong episode ng The Doctor is In. And if you were tuned in kanina, we just delivered some breaking news. So, just a reminder na mag-ingat pa rin tayo, of course, with COVID-19. So, ngayon, sasamahan ako ni Sir Roderick Dayag ngayong gabi para i-discuss ang mga COVID-19 precautionary measures. So, magandang gabi, Sir Roderick.
Magandang gabi, Rj Trish.
Yes.
Pleasure having me here tonight.
It is a pleasure to have you on the show tonight, Sir Roderick. So, kumusta ka po?
Ayos naman po. Okay lang.
Yes. So, Sir Roderick Dayag is an infection control practitioner at the Communicable Disease Center, a specialized hospital that caters to all types of infectious diseases here in the country. He is also a certified infection control practitioner by the Certification Board of Infection Control and Epidemiology Incorporated. He is also a certified professional in healthcare quality, a registered nurse specialized in the field of infection control, and infection control practitioner for 9 years. Right, Sir Roderick? In the Philippines, even in Saudi Arabia, and here in Qatar. So, good evening, Sir Roderick. So, ngayong gabi, i-discuss lang natin just a quick recap because just like what we were talking about earlier sa labas nung nag-uusap kami off-air, we know that you guys know, our listeners know, what to do and yung mga precautionary measures because we've been repeating them. Even dito sa radyo, may umeere tayong mga reminders. But of course, sabi ko nga, minabuti naming mag-imbita ulit ng professional to have a quick recap lang of the things that we need to do to protect ourselves and everybody around us against COVID-19. So, kasi baka yung iba very or a little too complacent with the lifting of the restrictions na naganap nga nitong mga nakaraang buwan. So, ngayon, i-discuss ulit natin ang COVID-19. So, Sir Roderick, how does the virus spread po ba? And how can we prevent it?
Okay, to start with, today alone we have 396 cases reported.
Yes.
And out of that, we have 353 cases reported community acquired. So it's really apparent that there is a community transmission of COVID-19.
Yes.
Now, to answer your question, para sagutin yon, how does the virus really spread? I think mas magandang maintindihan ng mga kababayan natin a little bit about infection cycle.
Yes.
There are 5 very important elements ng infection cycle na to. Unang-una is the virus itself, which is the SARS-CoV-2 or yung COVID-19 nga.
Yes.
Pangalawa, paano ba to pumapasok sa katawan ng tao? So there are portal of entries, primarily our eyes, our nose, our mouth.
Yes.
Okay. So these are the portal of entries. Now, let's talk about transmission. Paano ba to nalilipat sa ibang tao?
Yes.
Hindi naman pwedeng, Rj Trish, lipad ako papunta sa'yo, sabi ng virus, or kaya lakad ako sa'yo papunta. No, it has to have a very specific transmission ng virus na to. So again, this transmission is pwedeng, pagbahing, pag-ubo, or the mere fact na nagsasalita ka is a way that the virus can be transferred from one people to another.
Yes.
Now, pwede rin yung another component na dapat maintindihan is how does these viruses exits our body. Okay? So, kung saan sila pumasok, doon sila pwedeng lumabas. So, it's our eyes, our nose, our mouth. Okay? And of course, yung mga susceptible persons o yung mga tao, tayo, na pwedeng ma-infect ng COVID-19. So, these 5 elements dapat clear sa atin kasi if we know specifically on the transmission, portal of exits and entry, kung saan pumapasok at lumalabas, if we know how yung mechanics or mechanism ng transmission, malalaman natin kung paano natin ipoprotect yung sarili natin.
Yes.
So, this comes in, yung mga basic infection control measures na tinatawag. Basic in the sense na lagi nating ginagawa, we have our hand hygiene.
Yes. Yung masks.
Yung masks. and the physical distancing. But the question there is, are we really doing it? And if we're doing it, are we really doing it properly?
Yeah. So, sir, nabanggit mo yung hand hygiene na siguro yung iba di na rin masyadong ginagawa kasi siguro iniisip, wala naman na, bumaba na yung cases. But ngayon, what is hand hygiene and why is it so important? And yung sinabi nga natin, yung proper way to do it. Paano nga ba?
Okay. So, ang hand hygiene, sabi, it has been backed by so many researches.
Yes.
Ang dami-daming research tungkol sa hand hygiene, and the results or the outcomes of those researches are almost the same. Ibig sabihin, yung reliability nun is, or effectivity ng studies na yon is very much applicable to prevent the spread of infection.
Yeah.
Now, the question is, are we really doing it properly? This is implemented in the hospitals. Pero I think personally, as an infection control practitioner, there's no harm in practicing it in the community.
Yeah.
Kasi even a small kid can practice
Yes.
the proper way
agree.
of doing hand hygiene. So there are 6 basic steps as mandated by CDC and World Health Organizations.
Yes.
That is yung palm to palm, back of your hands, the knuckles,
Yes.
fingertips, and interlocks and interlace of your fingers. So, yung mga basic steps na yon, we have to do it properly all the time. Kasi sa kamay natin, sometimes pag naghuhugas tayo, hindi nami-miss natin yung mga ibang area.
Yeah.
In which these areas has a very great chance of us touching our face later on. Kapag hindi nahugasan yung kamay natin ng tama at nandun yung virus na hindi natin nahugasan, well, you can get infection from that.
Yeah. And sometimes we don't even know kung ano na yung mga natatouch natin, di ba?
Correct,
So,
correct.
importante din talaga yung hand hygiene. So, Sir Roderick, is hand hygiene just all about washing your hands? Paano ba yung sa alcohol, yung hand sanitizers? Are those as effective?
Yeah, alcohol is very much effective in very convenient and very effective. Kasi you just have to rub your hands with alcohol.
Yeah.
But you have to do it properly. I mean, the way of you doing it is all that matters. Sometimes it also depends on the scenarios. Kapag alam mong marumi yung kamay mo, madumi, you just have to wash your hands with soap and water. But if it's not visibly soiled, you can use your alcohol to do that.
Okay.
And timing is also important, as I mentioned earlier. Kasi if you do your hand hygiene with alcohol, it has
Yeah.
to be like 20 to 30 seconds.
Okay.
And hand washing is like 40 to 60 seconds.
Okay. So that's something na kailangan alam din talaga ng listeners natin. Kasi,
Yeah.
well, sabi nyo nga, very convenient yung alcohol, pero baka minsan we take it for granted na, basta lang may alcohol ako, I'm protected, that I'm safe. So, sir, you were saying?
Yeah, so gusto ko lang i-emphasize na yung paghugas ng kamay is talagang napaka-effective niyan. Kasi imagine how many times you touch your face on a daily basis.
Yeah.
Imagine how you use your hands to touch the high-touch surfaces in your office,
Sa
for example.
elevator.
Elevators, doorknobs, light switches, cabinet drawers.
Yes.
So those are high-touch areas na ginagamit natin yung kamay natin.
Yes.
And sinasabi na in 4 hours, you can touch your face up to 2,346 times.
Wow.
So, yeah.
Wow.
2,000, and 80% of that number is you're touching your mucous membrane.
Yeah.
So that's an easy entry of the organisms to your eyes, I mean to your body.
Yeah. Okay. So, sir, discuss na natin yung hand hygiene. So, I want to talk about the masks, the wearing of masks. Kasi,
Yes.
alam naman natin with the news for the past months na rin, marami din talaga silang nire-reprimand kapag nahuhuli na walang mask, especially sa places na kailangan talagang may mask ka. So, what is the proper way of wearing your mask, even removing yung disposal? Pwede ba siyang nakatambay lang sa isang tabi? So, what is the proper way?
Okay, RJ Trish, that is a very important question kasi there is really a proper way of wearing it, maintaining it in your face, and a
Yes.
proper way of removing your mask. Now, when you let's remember that our masks has three. I mean, nakikita natin magkaiba yung kulay, no?
Yes.
So blue on the outer side and then white on the
Inner side, yes.
So that white should touch your face because the white part is the absorptive part of the mask, which means the moisture that yung yung droplets galing sa atin is
Yes.
na-absorb ng mask. And the blue part is the repellent part,
Okay.
which repels kung halimbawa nasa harapan mo yung patient yung tao na,
Yeah.
I'm used to saying patient.
Hospital setting, yes.
Nasa harapan mo. So that repels the droplets na pwedeng pumasok sa'yo or pumasok sa portal of entries na nabanggit natin kanina.
Yes.
So, it's very important kasi minsan napapansin natin yung mga tao pag mina-manipulate nila yung mask nila. The chances are they are moving their mask
Yes.
on their chins. The worst part there is they are touching the exposed part. And as I mentioned, this is the repellent part of the mask. Yun yung parang kumukontra or humaharang sa mga droplet. Kung hahawakan mo siya, and then later on you touch your face and then
Yeah.
touch the other surfaces.
Yeah.
So you are really spreading the virus.
Ooh, okay.
Okay. Now, in the removal part of your mask, we do not grab it from the exposed part. Kasi minsan, can I bring out my
Yes,
mask?
sure, sir. Para mas ma-explain mo ng
Oo.
mabuti. At
Okay,
makita ng
so-
ating listeners and viewers on Facebook Live.
Teka, sige, ganito. So, when you're wearing your mask, you do it this way, right? I cannot wear the loops kasi yung sa
Yes, sir.
headset. Okay, so some people are moving their mask this way.
Yeah.
Like they're only
Binababa.
they're only covering their mouths, which is very improper. Kasi nga
You have to
nose-
cover your nose.
Nose is an entry and exit of the virus too. So sometimes may mga nakikita tayo na pag tinatanggal ang mask is hinahawakan dito, which I mentioned earlier, this is like
The repellent part.
the repellent part or the dirty part of
Yeah.
the mask. So the proper way of removing it is you just hold the ear loops. Hold the ear loops and then drop it in the bin. Afterwards, you do hand hygiene. That's
Okay.
it. Very simple.
So, yun ang proper wearing and removal. So, sir, gusto ko lang itanong din, gaano ba katagal dapat yung mask? Like, isang gamit ba, tapon agad? Or can it last for like a whole day?
May mga circumstances din kasi na kung halimbawa if the mask is torn or punit na siya, by all means you have to change it.
Yes.
If the mask is moist, kasi nga 'di ba part nun is yung absorptive part. If that is moist already, dapat itapon na 'yan. And sa guidelines natin from CDC, sinasabi na the mask would last maximum of 6 hours, minimum of 4 hours. So you have to change it after 4 hours or after 6 hours. They are recommending 6 hours if there is a scarcity of masks. It can still be fine until 6 hours, but the efficiency is not that good enough
Okay.
if you compare it to 4 hours
Yes.
usage.
Sir, regarding my question earlier, for example, I go to the office, I'm wearing my mask, and then I go to work, tatanggalin ko na yung mask ko. So for ilang hours, nandyan lang siya. Will that be okay? Or
That's fine.
okay lang
Yeah.
ba siya na nasa isang tabi lang, lalagay ko lang sa bag ko, okay lang ba yun?
Mas maganda siguro kung yung mask natin is meron siyang lalagyanan. I mean, a paper bag would do or like a plastic bag would do.
Can it
But
be a tissue?
a tissue, but you have to keep it on your bag. You don't wanna, put it aside.
Yeah.
Kasi you'll never know, somebody else will
Yeah,
touch
or
it.
yung exposed siya.
Yes.
Okay. So, salamat for that. Really, really curious about that. Sir Roderick, paano naman yung social distancing? Kasi so, na-discuss na natin ang hand hygiene, ang wearing of masks, yung social distancing, especially in today's setting, na bakit ba siya importante? Why is it necessary to prevent the spread of the virus?
Okay, so social distancing is you are physically distancing from each other.
Yes.
Okay, so I believe we are
Yes.
This physical distancing we have is enough. The suggestions are at least 6 feet away, right? 1.5 meters minimum. So this is also important kasi the droplets, can travel as far as 3 feet. So the velocity, pag humatching ka, kung halimbawa, humatching, the velocity is 5 meters per second square. 5 meters per second. So ganun kabilis yung velocity pag bumahing or especially pag bumahing. So the social distancing would prevent you from acquiring those droplets. Plus, of course, you have your mask.
Your
with you,
mask,
so you're very well protected. Social distancing in combination with all other preventive measures, isa yan sa mga effective measures to carve down
the spread of COVID.
Yes.
Yes. So, sir, nabanggit mo yung pagbahing or sama na rin natin yung pag-ubo.
Tama.
Yung cough etiquette. Ano po ba ang cough etiquette? Paano ba siya?
Well, cough etiquette, actually, more on ano na to yung parang respeto sa kapwa. Di ba? So, as Filipinos, Qabayans, we tend
Alam
to...
na natin
alam
yan.
na natin yan. Alam na this. Parang gano'n.
Alam na din.
So, pag bumabahing ka, you have to cover your nose
Yes.
and your mouth. Kasi nga, these are exits of viruses. If meron ka, if you have the virus, it's your responsibility to cover your nose and your mouth when you are coughing or sneezing.
So, paano po ba siya? Yung sa elbow ba?
So, ang recommendation is if you don't have tissue at reach, okay,
Kung walang
to
tissue.
cover your mouth and your nose, you can sneeze through your sleeves. But the question there is, are you doing it properly? Kasi nga, di ba, ang goal natin is to cover our nose and mouth. Sometimes, gumagano ka nga, pero
Ilong
exposed
lang.
naman yung ano. So, your nose and your mouth is
Yes.
exposed. So, that, although you use your sleeve, pero you're not using it properly. So, I highly advise na kapag ginagawa natin to is you make sure that you cover your nose and your mouth. That's the main goal of it.
Sir, what if you've mentioned kung wala kang tissue at reach, paano kung handkerchief mo? Will that be okay? Nagamit mo for the whole day?
Well, for the whole day.
Yeah. Sa work, dala mo, ganyan.
That's your personal pero just make sure that you keep it away. Wag siyang nakalapag kung saan-saan.
Yeah, because I was thinking, pag tissue kasi pwede mong idiretso
Yes,
ng tapon.
mas effective yun kasi
So, tissue
one single use
is always better. Okay. So,
kasi pag handkerchief, nandun yung bacteria or virus and then you'll use it again. So
Yeah.
I would rather prefer using tissue.
Yeah. Okay. Sir, maraming salamat for this quick recap of the things that we should remember ngayong may COVID-19 pa rin. And we've been seeing that COVID-19 cases are rising. So just your last reminders for everybody who is listening and watching sa atin ngayong gabi.
I always tell this during pag may mga lectures ako sa hospital, that if you protect yourself, you might as well protect the others.
Yes.
Kasi you don't wanna go home at the end of the day catching those virus and then go home and embracing your family,
Yes.
infecting them all. So, in the community, mas maganda i-practice na natin yung infection control or yung mga pamamaraan para maiwasan yung pagkakaroon ng virus.
Yes.
And practice all this hand hygiene, simple yet very effective in preventing you acquiring the virus. Wearing your mask properly,
Yes.
okay, and disposing them properly, and then your physical distancing and your cough etiquette too. So,
Yes.
yeah. So these are all like nowadays, these are more on your social responsibility already. Okay?
Yes.
So, although it's, we've been hearing, naririnig na natin almost every day,
Yes.
hand hygiene, you should do this and do that.
Every hour, actually. Yes. So,
Yeah. So,
social responsibility.
yes, it's more on your social responsibility. Qatar's government is doing all their best to
Yes.
protect their citizens and residents. So us Qabayan should also do our part in helping them.
Yes, kumbaga sa madaling salita, hindi naman na rin tayo kailangang sabihan pa.
That's true.
Kailangan alam na rin natin for ourselves, for our loved ones.
Correct.
Sa mga nakakatrabaho natin, nakakasama sa araw-araw. So, maraming salamat for that, Sir Roderick. Just my last question, may gusto ka po bang batiin ngayong gabi?
I just want to say hi to my wife. I missed you. And to my friends over at WWRC, Mikey, Dr. David, May, Chuko,
Yes.
Peter, and Tina. And to all the nurses of Communicable Disease Centers. I know you guys are exhausted and
Busy.
tired, busy, but just keep your head up high. Okay?
At, yes. Meron pa ba, sir?
I think
Go
that's
lang.
it. To all my friends, so I cannot mention you all, but yeah.
Yes, so and on behalf of Qabayan Radio, Sir Roderick Dayag, maraming salamat for gracing us with your presence, and
My pleasure.
maraming salamat sa mga frontliners natin na siguro ay minsan nakakalimutan na rin natin pasalamatan dahil nga feeling natin siguro medyo nababawasan na rin yung cases. So, but still, COVID-19 is present, and we still have to take care of ourselves and everybody around us. So again, that was Sir Roderick Dayag, an infection control practitioner at Communicable Disease Center. I hope you guys learned a whole lot, just like how I learned. Sobrang, alam ko naman, alam nyo na yan, pero kailangan natin ng refresher from time to time. So maraming salamat, Sir Roderick. That was your third episode of The Doctor Is In. So mag-ingat pa rin po tayo, mga kabayan. Maraming salamat for tuning in and for watching us on our Facebook page. I am going to be back in just a bit. Let me take a quick break. This is Trish on the After Shift, only here on Qabayan Radio 94.3.